We will start then, or we'll wait for someone. Okay, we'll start with it. So we will be discussing 25 questions as mentioned before. So now the first question is, you are a junior resident in the ENT department. Then a patient presents to you with a pulsatile tinnitus. Which of the following will be your first differential diagnosis? CSOM, ASOM, masteritis or glomus tumor? So it is very simple. The patients come to you with pulsatile tinnitus, and what will be the differential diagnosis? First differential diagnosis: CSOM, ASOM, masteritis or glomus tumor? Okay, I'll repeat once again last. See, a patient presents to you with pulsatile tinnitus. Which of the following will be your first differential diagnosis? CSOM, ASOM, masteritis or glomus tumor? This you have to remember, because pulsatile tinnitus will be present in its condition. Because see, CSOM, ASOM, I don't think it will be there, because it's only a patient. So the answer here is glomus tumor. Yeah. Glomus tumor will be your first differential diagnosis, because it is third one. No, not third one, it is D, glomus tumor. See, glomus tumor will be pulsatile, synchronous with pulse, and can be temporarily stopped by carotid pulse. So next question we have, this is a biochemistry question. Yeah. Which of the enzymes is not involved in oxidation reduction reaction? Which of the enzyme is not involved in oxidation and reduction reactions? Your options are dehydrogenase, hydrolase, peroxidase and oxygenase. So this you need to know, because what is the function of each of them. The question is, which of the following enzyme is not involved in oxidation and reduction reaction? The options are dehydrogenase, hydrolase, peroxidase and oxygenase. Anyone? See, the answer here is hydrolase, because others, dehydrogenase, peroxidase and oxygenase are basically involved, and while hydrolase is basically it's not involved, it's for only hydrolysis of substrate. That's why. Yeah, they have given C here. See, oxidoreductase will be dehydrogenase, oxygenase, oxidase, catalase and peroxidase. Hydrolase, hydrolase is the right answer. Next question, moving on. A young woman presents to you with complaints of painful menstruation and post-menstrual spotting is there. On examination, you note a tender nodules in the posterior fornix and a fixed retroverted uterus. Internet is going around. Okay. So which of the following is gold standard investigation to confirm the diagnosis? Ultrasound, laparoscopy or hysteroscopy? I'll repeat the question. Let's see what I think is. Okay. See, a young woman presents to you with painful menstruation. On examination, you notice a tender nodule in the posterior fornix and a fixed retroverted uterus. Which of the following is a gold standard investigation to confirm the diagnosis? USG, laparotomy, laparoscopy and hysteroscopy. And you need to tell a diagnosis first before this gold standard investigation to confirm. Laparoscopy is the right answer. See, diagnosis based on the whatever they have given is endometriosis. And for endometriosis, the gold standard is laparoscopy itself. And yeah. See, the clinical case scenario is of dysmenorrhea and tender nodules and a retroverted uterus, which is suggestive of endometriosis. And the gold standard is laparoscopy. Next question we have is, a patient presents to you with serous discharge from an opening located in the perianal region. On examination, the location of the external opening was 8 o'clock position. According to the Goodsell's rule, at which position from the dentate line will be the internal opening be palpated in this patient? 8 o'clock, 4 o'clock, 1 o'clock or 6 o'clock? So the patient presents with you with serous, I'll give the answer once. Yeah. The patient presents with you with the serous discharge from an opening located in the perianal region. And on examination, what you see, there is a external opening at the 8 o'clock position. So according to Goodsell's rule, what position from the dentate line will be the internal opening be palpated in this patient? 8 o'clock, 4 o'clock, 1 o'clock or 6 o'clock? So as per the given case scenario, it is fistula because it is located in the perianal region. They haven't, and that too at the 8 o'clock position. So it's not a normal opening here. So the answer here is 6 o'clock. Why? See, what they have given is the given case scenario is fistula in ano with external opening at 8 o'clock position, which implies external opening of the fistula is lying posterior to the midline. Yeah, okay. Then according to the Goodsell's law, please repeat. Okay. I will just tell the answer then. Okay. See, the question here is, patient comes to you with a serous discharge from an opening located in the perianal region. Okay, on examination, the location of the external opening, what I said, is at 8 o'clock position. So according to the Goodsell's rule, at what position from the dentate line will be the internal opening be palpated in this patient? 8 o'clock, 4 o'clock, 1 o'clock or 6 o'clock? Okay, you got the question. So yeah, the answer is, as you said, it is 6 o'clock. See, according to the Goodsell's rule, fistula with an external opening posterior track in a curvilinear fashion to the posterior midline. You have to remember by the image only. That's why I can tell it is 6 o'clock. Because see, fistulas with an external opening posteriorly, it will be in curvilinear fashion. That's why it is to the posterior midline. And if it is anterior, it will be to the internal opening by radial track. Okay, next question we have. What is the treatment of choice for a patient diagnosed with sagittal sinus thrombosis? See, the options are aspirin, heparin, warfarin or RTPA. So what is the treatment of choice for this? Of the sagittal sinus thrombosis, aspirin, heparin, warfarin or RTPA? Thrombosis. Anyone wants to answer this? Sagittal sinus thrombosis. Okay, the answer, no one wants to answer. Okay, the answer here is heparin. IV heparin is the drug of choice for sagittal central venous thrombosis, that one is sagittal sinus thrombosis. It prevents further thrombosis and reduces venous hypertension and ischemia. Okay, next, warfarin. No, warfarin is not the answer. Drug of choice is heparin. Now see, a 25-year-old woman comes to you after 1 year postpartum. She was treated for iron deficiency anemia during pregnancy. Her current hemoglobin is 5 gram per dl and reticulocyte is 9%. What is the corrected reticulocyte count? Sets 4.5, 3, 0.5. This basically you have to calculate. So a 25-year-old woman is there, comes to you 1 year after the postpartum, and she was treated for iron deficiency during the pregnancy only, but now current hemoglobin is 5 gram per dl and reticulocyte is 9%. What is her corrected reticulocyte count? So here you have to use the formula for the corrected reticulocyte count. So the answer by that formula is 3. See, the formula what it is, reticulocyte count into the patient's hemoglobin or hematocrit. So it is 9 into 5 by 15 by standard hemoglobin. I will repeat what is the formula. It is the reticulocyte count into the patient's hemoglobin divided by the standard hemoglobin. So standard hemoglobin, we all know it is 15th. As it is normally 14, but we will assume it as for calculation 15th. So it is 9 into 5 by 15. That is 9 by 3. That is 3. Okay, next question we have. A surgeon decides to resect a part of muscle while operating on a case of strabismus. This action would lead to which of the following? Weakening of the muscle, strengthening of the muscle, paralysis of the muscle, no change in the strength of the muscle. So basically, he wants to resect a part of a muscle. The main point here we have is it is a case of strabismus. So what action will lead to that? Weakening, strengthening, paralysis, or no change in the strength? So the answer here, anyone wants to answer this? So there are different surgeries for this. So in this, see, first the answer I will tell it is strengthening of the muscle. It is a squint surgery in which it leads to strengthening of the muscle. The main type of procedure are weakening, strengthening, vector adjustment procedures or transposition. So strengthening is weakening is not. See, weakening, see, in this procedure there are 4 things: weakening, strengthening, vector adjustment, and transposition. So what you said is weakening. Weakening will have recession, disinsertion, and posterior fixation suture. So basically, whole procedure you have to remember. And strengthening is a part of the resection. It's resection, tucking, and advancement. That is a part of strengthening. So the procedure we have to remember. Otherwise, it's okay. Next question we have. Which of the following is not a reversible cholinesterase inhibitor indicated in a patient with Alzheimer's disease? The options are donepezil, rivastigmine, galantamine, memantine. So I repeat, which of the following is not a reversible cholinesterase inhibitor indicated in a patient with Alzheimer's? So options are donepezil, rivastigmine, galantamine, memantine. Okay, tell me which of these are NMD receptor antagonists. In that way only we can answer this. Donepezil, rivastigmine, galantamine, and memantine. Fourth one, yeah, memantine is an NMD receptor antagonist, which is used to treat the moderate to severe case. And see, others are also part of the treatment of Alzheimer's, but they are actually reversible cholinesterase. And so not, it is memantine. Then the question is, which of the following is a false statement regarding nocardia? So they are aerobes, they are acid fast, they are commensals, they produce urease. So we have to tell false about nocardia. They are aerobes, acid fast, commensals, or they produce urease. This you have to tell anyone. So first we can rule out basically see which is the false. Then I'll only tell. See, they are aerobes, they are acid fast, they produce urease. This all of this. They are not commensals. That's the answer. The third one is the answer. They are weakly acid fast. They are most commonly involved in human disease. They produce urease. So the answer is they are not commensals. Next we have, which of the following poison causes a bluish discoloration of the stomach mucosa on post-mortem examination? This is a forensic if anyone can tell. See, the options I will tell are oxalic acid, sodium amytal, soneryl, and arsenic. So which is the poison which will cause a bluish discoloration of the stomach mucosa on post-mortem examination? oxalic acid, sodium amytal, sonoril, or arsenic. Okay, I will only tell the answer. See, the answer is sodium amytal. See, for all the options they have given oxalic acid, no. Oxalic acid we won't call this. See, it is sodium amytal. See for arsenic, if you see in the postmortem, arsenic will have a red velvety mucosa. Then that sodium amytal already said. See, if you have H2SO4, it will be black or brown with erosion, perforation, and carbonization. And phosphorus, it will be yellow or grey white. If it is blue only it is when sodium amytal and copper sulfate is there. Then only it will be blue. Otherwise, others colors are there, but it won't be blue. Next, we have a patient presents with a painless swelling of the neck. The histology of the tissue is given in the image below. What is the diagnosis? Okay, we'll check the histology. If I tell the histology, the answer you will get. Okay. Okay, I'll just tell what it is there in the histology. It is Hartel cells are there, germinal center is there. But without seeing the histology, you won't be able to answer this. Okay, what is the differential diagnosis? You can tell at least. What is the differential diagnosis of swelling of the neck? Painless swelling of the neck. Options what they have given is medullary carcinoma, non-Hodgkin's, Graves, and Hashimoto's thyroiditis. Okay, without pathology, you cannot answer also. Okay, leave this question. But the answer here is Hashimoto thyroiditis, because all the pathological features they have given in this image. Lipoma is not in the. Okay, differential diagnosis you were telling. Yeah, lipoma will be. Lipoma it is painless. Dermatoid also. Lipoma can occur anywhere. Neck it is not. Back of the neck I've seen. Yeah, dermatoid also is there. Lymphadenopathy also will be there. It is also painless. If it is lymphadenitis, then it will be painful. Okay, next question we have. Patient presents with weakness of the right side of the face with loss of pain and temperature. Pain and temperature sensation of the left leg is also lost. The lesion is most likely located at medial medulla, lateral pons, medial pons, and lateral medulla. So basically, thyroid loss also is, thyroid. So the question here is patient presents with you with the weakness of the right side of the face. The right side of the face has the weakness and with both loss of pain and temperature, and pain and temperature is also lost on the left leg. So you have to tell which is the most likely located lesion located where: medial medulla, lateral pons, medial pons, or lateral medulla. It's a syndrome because it is right side of the face and left leg. The answer here is lateral. Basically, what the syndrome is, lateral pontine syndrome is present, and in that it is lateral pons is involved. It occurs due to the involvement of the anterior inferior cerebral artery. Basically, you have to know it is all that artery they have given ipsilateral. I will tell this. See, the medial pontine syndrome, it will be having a ipsilateral manifestation, that is diplopia will be there, nystagmus will be there, ataxia of the limb and gait will be there, and on the contralateral it will be paralysis of the face, arm and leg, loss of touch and proprioception from the body. So it has both manifestation in contralateral as well as ipsilateral. So next question we have: a patient comes with you with a history of drug intake for her gout and was diagnosed with Lewis syndrome On examination, which of the following cutaneous findings are most likely to be seen? So the patient has basically its history of drug intake for a gout and diagnosed with Leal syndrome. And what are the cutaneous findings most likely to be seen? The options are localized pruritic skin and mucosal macules with erosions, purpuric macules and erosions that affect 10 to 30% of body surface area including mucosa, purpuric macules and erosions that affect more than 30% of body surface area including mucosa. The last option is purpuric macules and erosions that affect the major flexures. So you should know about Leal syndrome first. It is Leal syndrome, Lyall syndrome. So I've also heard first time. Leal syndrome. Okay. What Leal syndrome it is? See what is Leal syndrome? 30%. Yeah, that is the answer. Leal syndrome is basically toxic epidermal necrolysis. This now I didn't name. Okay. It is the other name for toxic epidermal necrolysis, and this is more than 30%. Yeah, the answer is more than 30% surface area. They can change the name only like this. And okay. Next, the question is, which of the following is not a criteria for severe acute malnutrition? Then the options are weight for height less than -3 sg, MUSC less than 110 mm, bilateral pedal edema, and weight for less than -3 sg. So which of the following is not a criteria for severe acute malnutrition? Weight for height less than -3, MUSC less than 110, bilateral pedal edema, and weight for age less than -3 sg. See, if it is acute, then stature. See, weight for height will be less than -3. It will be, I think, in that chronic. Yeah, weight for height will be in chronic. So here they have given severe acute malnutrition, not a criteria. Okay. Good answer they have given is weight for age less than -3 sg is not a criteria for severe acute malnutrition according to WHO criteria. So the criteria, the criteria is mid upper arm circumference less than, that is MUSC, less than 11.5 centimeter, presence of bipedal edema, and weight for length, that is height, below -3 sg of WHO child growth standards. Okay. So weight for age less than -3 sg is now considered to be criteria for severe acute malnutrition. Next, we have a 48-year-old woman who underwent a renal transplant 4 months ago. Comes for a follow-up. Which of the following would you perform to assess her renal function? Basically, investigations: TC99M DMSA, TC99M DTPA, TC99M MAG3, and captopril DTPA. So 48-year-old underwent renal transplant 4 months back, comes for follow-up. What will you perform to assess her renal function? TC99M DMSA, TC99M DTPA, TC99M MAG3, captopril DTPA. Please repeat. See, MAG. Yeah, MAG is the right answer. See, renal function is best assessed by TC99M MAG3, that is mercaptoacetyl lysine. It is eliminated from the kidney through the both glomerular filtration as well as through tubular restriction, and it's a measure of both. Okay, we will tell the options also. Let's see. TC99M DMSA is also used to evaluate the renal structure and morphology, particularly in pediatric age group, but it is not the best. Best is, but it is both absorbed and secreted. That's why it is the correct answer. And then DTPA for function. Yeah, it is for GFR basically. Direct measurement of GFR. So the answer here is math 3. DMSA shows such a star. Okay. When next question, a nursing assistant is posted in the obstetric care unit was asked to plot a partograph to monitor the progress of labor. After how much dilatation of the cervix should she start plotting the graph? 2 centimeter, 4 centimeter, 5 centimeter, or 6 centimeter? This I think you all would be knowing this. In a labor posting, we have done this. See, it is what they are telling you, it is you are in a labor posting basically, and you are measuring a partograph. So after how much dilatation of the cervix should you start plotting the graph? 2 centimeter, 4 centimeter, 5 centimeter, or 6 centimeter? This hospital. Okay, the answer here is 4 centimeter. I think you should know this. See, in a partograph, basically it is divided into latent phase, active phase. Okay, when in the latent phase, the cervix is dilated up to 4 centimeter, whereas in the active phase it is more than 6 centimeter. So basically you will start when it is 4 centimeter, and that time only you can start the partograph. Yeah, 4 centimeter is right. I think I'm not getting the comments. I'm getting the comments late. Okay, no problem. See, a district leprosy officer is preparing the annual report as per NLEP 2020. So, which of the following parameters should he not consider as an essential indicator? So, I will repeat again. It is a district leprosy officer who is preparing for the annual report as per the NLEP 2020, and which of the following parameter? Your video is paused. Am I audible? Yeah, internet is so late. Am I audible? Please reply yes or no. I think it is paused. No, it is. Okay, I'll continue. I think it is not paused from my side. Okay, which of the following parameters? Yeah, carry on. Okay. So, which of the following parameters would you not consider as an essential indicator? Yeah. See, it is the options are treatment completion rate, that is TCR, prevalence rate, that is PR, then the rate of new cases with rate to disabilities per 10 lakh population per year, and proportion of new cases correctly diagnosed. It is a PSM question. I think we were not interested that time. Now also I'm not interested, but we have to remember this. So, which of the following would not be considered as an essential indicator? And the answer is proportion of new cases correctly diagnosed. See, I will also read all this. Okay, what they have given is the proportion of new cases correctly diagnosed is not included under the essential indicators. It is a part of quality of service indicator as per the NLEP 2020. Then what are the essential indicators under the NLEP 2020? First is the brain. Okay. The essential indicators is annual new case reduction rate per 1 lakh population, rate of new cases with rate to disabilities per 10 lakh population per year, treatment completion rate as a proxy to cure rate, and prevalence rate. So this you have to remember. I cannot help in this. I also don't like. Okay, then next question we have: what drug can be used to prevent hallucination and vivid dreams that can occur as an emergency reaction during the anesthesia recovery period? So the options are ketamine, atropine, propofol, or midazolam. So basically they are asking which is the drug to prevent hallucination and vivid dreams that can occur as an emergency reaction during anesthesia recovery period. In the recovery period, which is the drug which will prevent all this? Ketamine, atropine, propofol, midazolam. anesthesia. I don't think that is midazolam. Yeah, midazolam is the right answer. See, benzodiazepines like midazolam are the most effective group of drugs in prevention of this reaction. Next question. See, they have given a ECG here. I don't know how to show. Okay, we'll see it. ECG of a patient who was brought to the casualty due to severe chest pain followed by syncope is given below. What is the likely diagnosis? Without seeing the no one can tell. Midas causes antegrade amnesia. So in natal letter, the ECG will be having the tachycardia will be there, and sawtooth shape wave will be there. So okay, next question. A 60 kg adult male has a hematocrit of 40 and a plasma volume 3 liter. So what is the total volume in liter? 4, 5, 6 and 7. What is the total blood volume in liter? 4, 5, 6 and 7. So you have to calculate. There is a formula for this. 60 kg is there, hematocrit is 40 and plasma volume is 3 liter. What is your total blood volume in liter? 4, 5, 6 and 7. Okay, the answer. But do you know the formula? Formula is important here. Because the answer is. Okay, I will only tell. Okay, the answer is 5. Formula is plasma volume by 1 minus hematocrit. So the plasma volume they have given 3. 3 by 1 minus 40. 40 they have given. So it is 3 by 1 minus 40, that is they have given 5 liter. Hematocrit is always in percentage. That's why it is 40 by 100, that is 0.4 considered for the formula. Cells is not the answer as per the formula. The answer is 5. That is 3 by 1 minus 0.4. Because 40 we do 40 by 100, that is 0.4. Then we have which of the following is a formal thought disorder? Psychiatric version. The options are obsession, derailment, delusion, thought insertion. So which of the following is a formal thought disorder? Obsession, derailment, delusion, thought insertion. Okay, the answer here is derailment. It is a formal thought disorder. So, see what is a formal thought disorder? I will just tell you what they have given us. It is a breakdown in both the logical connection between the ideas and overall sense of being goal oriented. It is generally identified in schizophrenic patients as a generalized loosening of associations. So, what are the disorders? Derailment. So, what are the formal thought disorders? The names, at least you have to remember. The circumstantiality, clang association, derailment, flight of ideas, neologism, preservation, tangentiality, and thought blocking. Yeah. Next question we have a young sportsman presented with pain in his right elbow. On examination, Cogen's test was positive. What is the possible diagnosis? Rotman's elbow, pitcher's elbow, golfer's elbow, tennis elbow. So there is a pain in the right elbow and Cogen's test is positive, probable diagnosis. Rotman's elbow, pitcher's elbow, golfer's elbow, and tennis elbow. See, first tell me what is the Cogen's test. Otherwise, you won't be able to tell which elbow it is. Okay, see, the answer here is tennis elbow. And what are the tests we use for tennis elbow? Is that Cogen's test is given that Cogen's, Mills, Bringy, and Mosley test. So in Cogen's test, what we do, we ask the patient to pronate the forearm and make a tight fist. Then wrist extension against resistance causes a pain at the lateral epicondyle. Which muscle we are using here is the muscle commonly involved is extensor carpet radialis brevis tendon is involved. So it is Cogen's test in tennis elbow. Basically, you have to pronate the forearm and with a tight fist, and wrist extension will cause pain. Okay. Next, we have a patient on intravenous vancomycin develops flushing and erythematous lesions. On examination, tachycardia and hypotension are noted. By what mechanism does vancomycin causes these effects? Allergic reaction, direct toxic effects on mast cells, histamine antagonist reaction, and immune complex deposition. So basically, you give a patient intravenous vancomycin and it develops adverse effects. That is the flushing and erythematous lesions, tachycardia and hypotension. So by what mechanism they are doing all this? Mast cell, okay, allergic, I will repeat once more options. Allergic reaction, direct toxic effects on mast cells, histamine antagonist action, and immune complex deposition. Yeah, the answer you said is right, that is the mast cells. There is a syndrome for this which is associated with vancomycin, that only, red man syndrome, and it occurs through direct toxic effects on mast cells with the release of histamine, and all this we can see. Flushing, erythematous, tachycardia, hypotension will be seen. So what we give is prophylactic, we use antihistamines for this. It is due to actually rapid, red man syndrome. It is rapid infusion. If you do vancomycin, then it will happen. Otherwise, it won't happen. Next, we have which is the most common non-Hodgkin lymphoma in India. Yeah, the table was there. The options are Burkitt's lymphoma, diffuse large B-cell lymphoma, Mart lymphoma, and follicular lymphoma. So most common Hodgkin lymphoma is in India: Burkitt, diffuse large B-cell, Mart, or follicular lymphoma. One table was there in which you have to remember all. In children, it is the most common. In India, most common. And see, the question is most common non-Hodgkin lymphoma in India. So the answer here is diffuse large B-cell lymphoma. It is the most common non-Hodgkin lymphoma in adults and children both, in worldwide and in India also. So here one more you have to remember, Burkitt lymphoma is the most common NHL, that is non-Hodgkin lymphoma, under the age of 15 years in children. So in adults it is Burkitt, diffuse large B-cell lymphoma. In adults it is diffuse large B-cell lymphoma. In children it is Burkitt lymphoma. That is below the age of 15 years. So the last question for today. Mother brings her baby to her PHC saying her that the child has gone limp. She mentioned that the child had recently been given some oral drops as a part of mass vaccination campaign. Which of the following is the most likely cause of the baby's symptoms? Rotavirus vaccine, oral polio vaccine, oral typhoid vaccine, oral cholera vaccine. This is very simple. If you give some oral drops in India, okay, I'll repeat. A mother comes with a child and the child has gone limp. She mentioned that the child has recently been given some oral drops as a part of mass vaccination campaign. Which of the following is most likely? Oral polio, rotavirus, oral typhoid, and oral cholera. Yeah, the answer is oral polio, because in India it is a mass campaign. So the given scenario is suggestive of paralysis, and it is likely due to the vaccine associated paralytic poliomyelitis following OPV administration. So it is a very rare side effect. Acute onset flaccid paralysis occurs within 4 to 30 days of the receipt of the vaccine in these cases, or within 4 to 75 days after the contact with the vaccine recipient. So yeah, it's over for today also. So today we have done actually 25 and afternoon 25 in the, yeah, good night. Good night, see you then. Take care.